Southern Brooklyn is home to a broad and diverse group of patients.
We work with a population that comes from a variety of backgrounds, including different cultures, different religions. They speak different languages, have different financial situations, which makes this position really rewarding that we get to work with people of all different statures.
In the acute care division, we are in the midst of two major clinical programmatic build-outs, brick and mortar build-outs. One relates to our emergency service. Received an Office of Mental Health grant, a $6 million grant to build a new psychiatric emergency room, and also have it designated as a higher level of care, what we call in the state of New York a CPEP, a Comprehensive Psychiatric Emergency Program. That allows us to provide more services to patients that are coming for emergency psychiatric care.
Over the past year or so, we have added one large part of our division that was missing since the inception of our Department of Psychiatry, which was addiction services. Now, with addiction services officially here, we don't say no to patients. Starting with the acute care services, patients come into the emergency room with acute psychiatric complaints, things that are really disrupting their day-to-day functioning. If the patients are determined to need ongoing care and they are determined to be either dangerous to self or to others or deemed not able to take care of themselves in the community, they are admitted to our inpatient units. We have 2 inpatient units that serve 70 inpatients at any time. Full service, including everything from high-quality psychopharmacological care to art therapy and everything in the middle. Moving on to when the patients get discharged, they need urgent appointments, and we accommodate anyone with any urgent needs in our outpatient services within 1 week of discharge. We are proud to host Brooklyn's only academic LGBTQ treatment services. We also have culturally competent care here. We are developing specialized services for the Spanish-speaking community as well as the Chinese-speaking community.
They sent me to different programs, but I came back to Maimonides because I realized I was letting something go away from me. And since then, I've come hoops and really gone ahead. The other programs I left, they weren't as rich. They didn't have these facilities, they didn't have the know-how, they didn't have the ability to lead me. They make me feel grounded. They make me feel like I can be myself.
In 2025, we have a lot of exciting things going on. We are opening a psychiatric emergency room that will serve South Brooklyn and that will function as a comprehensive psychiatric emergency program. And we are also working to build a 20-bed adolescent unit that will serve adolescents age 13 to 17 who are in particular need of inpatient mental health care. Maimonides was awarded grant money to turn our psychiatric emergency room into a CPEP. A CPEP is a very exciting designation for Maimonides because it means that we're able to provide more wraparound care services for our patient population and patients in need in South Brooklyn. We will be able to expand crisis services, outpatient services, an expansion of social work, art therapy, addiction services, which will overall really help to serve the patients in our catchment area.
We blend the strength of a community hospital with the academic rigor of a major training center. Our trainees are exposed to a wide spectrum of psychopathology, patient presentations, exposure to subspecialty training, while also engaging in scholarly activity, quality improvement projects and initiatives, and original research.
Some of the training that I am doing to work with agitated patients, it's called trust training. It is an OMH, Office for Mental Health initiative. It is specifically designed for reducing restraint episodes and really just making sure that we are leading with empathy and integrity and leading with recovery-focused and strength-based approaches. It's been rolled out in the last year and a half. We have seen a tremendous improvement in satisfaction from the staff. They feel that they have these incredible tools to use with patients when they get agitated.
We are an academic Department of Psychiatry on the move with a tremendous growth curve that's housed in a community mental health center with the innovation, with cutting-edge research, technology, but staying true to our mission and our tradition of caring for a very vulnerable population with a tremendous amount of diversity that is the Brooklyn tapestry of life.
Thanks for watching, but now an important disclaimer. The content of this video is not intended to be a substitute for professional medical advice, diagnosis, or treatment. Viewers should not disregard or delay in obtaining medical advice for any medical condition they may have and should seek the assistance of their healthcare professionals for any such conditions.